You cannot have a muscle spasm. You cannot have a cramp. You cannot have weakness. You cannot have instability. All that stuff is normalized because physiology is doing its job. When you, as a clinician outside of that patient's body, think and determine on your own that that patient needs you to do something to force something to happen, you just screwed up and they lose. Your body can do what it needs to do when it's allowed to do it. Most of the time when we have patients come into our clinics, we are breaking them and making them worse by doing things that forces them into positions that they can't handle. And then we send them home, or we figure out, oh, well, that flared things up. Well, let's put them on stem and ice and heat, and let's do some massage, and let's do some cupping and whatever fuckery we have laying around the clinic, and we do that stuff, okay? So to help you guys out, because I know you guys understand everything that I just talked about on at least some level. You might not have a firm grasp of it, but you're like, the wheels are turning and you're getting close. So here's what I'm gonna do this coming week. I'm going to shoot another reel. And what I'm going to do, so another comment that I keep on getting on this is that, well, the reason why his strength went down by a third is because you made him do 2 isometric contractions within the same minute. No, that's not the way it works, okay? So if you have a muscle that has normal neuromuscular facilitation, it's facilitated, and you have that muscle do an isometric contraction, and you rest for a little bit, and do another isometric contraction, and you rest for a little bit, and you do another isometric contraction, and you rest for a little bit, the strength, the force output will either stay basically the same or it will increase. So I'm going to do a video this week that will demonstrate that. I will also do a video that if you have a muscle that is inhibited and you do repetitive maximal isometric force output isometrics, then it will decrease. Okay, so so here's the problem with posting videos on Instagram. I only get 90 seconds to jam as much stuff in there as I can. Okay, so what I'm going to have to do, and I don't want to shoot a clip for 30 seconds, then shoot a clip for 30 seconds, and shoot a clip for 30 seconds and glue them together, because then everybody who doesn't understand physiology is going to say, oh, well, you did something in between those clips. So I want it to be one continuous video. So what I'm inferring that I'm going to have to do is shoot a 3-minute video and then put it on 2 times speed, so I can get a 3-minute video into a 1.5 minutes. So here's my plan. I'm going to take somebody and I'm going to have them do 3 maximal force output knee extensions, just like we did in the reel last week. And you're going to see that their force output is either going to stay basically the same or it's going to go up. How do I know this? Because that's science, that's physiology. And then what I'm going to do is I'm going to do the 10-second stretch. And then I'm going to have them come back and their force output is going to decrease by somewhere between 25 and 30%. And then I'm going to have them do maximal force output isometrics 3 after I've caused the inhibition with the stretch. And what do you think is going to happen? Their force is going to go down and go down and go down. So we're going to demonstrate that when you have an inhibited muscle and you have it do exercise, now we're going to use isometric because that's what I have the ability to do with a dynamometer, but I've done this before too. If you do squats with somebody who has quad inhibition, their force output will go down. So that's why corrective exercises don't work. So if somebody comes into your office and you say, oh, you're weak, we need to do exercise. Nope, that's not the way it works. That's not the way physiology works. It's not a sometimes thing. It's an all the times thing since the beginning of time. Okay, so if you have somebody do exercises with an inhibited muscle, they will figure out how to compensate for that inhibited muscle and their force output will go down. Their technique will go down. Their risk for injury and pain will go up. So this is what I'm going to demonstrate. So I'm going to do 3 maximal output contractions, knee extensions, same setup, with a facilitated muscle. Then I'm going to cause inhibition. So remember, when I'm stretching them, I am causing inhibition. That's why the force output goes down. This has nothing to do with the Krebs cycle and whatever else people want to make up, okay? It's really easy. This is way easier than a lot of people are making it. I'm causing neuromuscular inhibition by stretching the muscle, okay? Then we're going to come back. We're going to retest it 3 times, force output's going to go down. So I'm predicting this. I'm like kind of like Nostradamus here. No, I'm not. I just understand physiology, so I know what's going to happen. All right. So watch that. And if you've got questions, or if you've got questions on the last one that I did, post the questions below. If you don't understand physiology, like if you don't understand, like what should I do when somebody has a hamstring cramp? Or what should I do when somebody has tight hamstrings? Well, the first thing that you shouldn't do is go to the hamstrings, because the hamstrings aren't the problem the majority of the time. Okay? It's either the quads as a reciprocal response or the glutes as a synergist that are causing the problem. And even if it's one of those scenarios, it's not just one thing. That's why you have to run somebody through a screen to see what they can and can't do with gross motion. Then when you put them on the table and break them down muscle by muscle, then you can figure out which muscles are inhibited. If you're not doing that, you're guessing and you're losing and your patients are getting worse, even though they feel better when they leave because you put them on stem and ice and whatever, and massage feels good and stretching feels good, until they get home and they stand up out of their car and bingo, their hamstring tightness is back, because you didn't use physiology. All right. So post questions about physiology, about the reel, the stretching reel. Yes, I know. So Josh and I got done. We're like, sweet, we did that in one take. So we're looking at the video and Josh said, well, I could kind of feel the loop, the band thing moving up my shin a little bit on the second test. And I was like, okay, some idiot is going to say, well, he lost the force production because the thing moved up, blah, blah, blah. Okay. You're not going to lose a third of your force production because the band moved from here to there as you're doing the extension. The point of the reel is when you stretch people, you are decreasing force output because you're causing neuromuscular inhibition. That's the whole point. And the secondary point is you should never be stretching anybody for any reason. Oh, and also add massage, Theragun, myofascial release, whatever. Anytime you, as an external person, force, whatever, are dictating and forcing the patient into a position that their body cannot tolerate on a physiological level, you are violating physiology and you are making them worse. Period. All right. So if you got questions on that, post those below. Pay attention this week as I do the longer version, and hopefully I can get that done in 3 minutes and then shrink it down to a minute and a half. All right. Talk to you guys later.